We're going to talk about TB in this lecture, tuberculosis. So what about it? Well, it is an infectious disease. It is contagious. It's caused by the Mycobacterium tuberculosis. It usually involves the lungs, but it can involve other organs. It is the leading cause of mortality in the patients with HIV. So let's think about it. Who's at risk in the United States to develop it? Prisons, because of the setting, their close contact. Homeless, foreign-born, people coming from third world countries. People who live in inner city because they're close in proximity. IV drug abusers, immunosuppressed people, like the population like HIV. They're more susceptible to because their immune systems can't fight it off. So let's talk about latent TB versus TB disease. Latent means you have no symptoms. You don't feel sick, but you can't spread it. But you do have a positive test. You actually will have a normal chest x-ray, but they still need to treat it to prevent active TB from developing. Now, TB disease, they have symptoms. They have a bad cough, usually greater than 3 weeks, maybe coughing up blood in their sputum, or just coughing up sputum. Weakness, fatigue, chills, nighttime sweats are another symptom. They will definitely have a positive TB test. They will also, majority will, but most will have an abnormal chest x-ray. And they need treatment. So, how are we going to diagnose with TB? Okay, so skin test is done. Mantoux, lots of times, but now actually they're doing serum blood draws to see if you're carrying TB. If you're from another country where you've had a vaccine that interferes with it, that you can't have the skin testing, you'll have your blood drawn. Or even in some cases a chest x-ray done. The other way we're going to make a concrete diagnosis is getting a sputum sample. In your diagram here, you see on the slide how to teach the patient how to get a sputum sample. It's crucial that they follow these steps because you don't want the sputum sample contaminated. You want to get the sputum sample first thing in the morning, and for a positive diagnosis, we're going to get a total of 3 specimens. Usually, we'll want to do it on different days. So remember these important tips. First morning sputum, and you want it on 3 separate days. Okay, and you're going to send each of those down to the lab, and what they're looking for is the TB bacillus. Treatment, usually not treated as in the hospital, treated as an outpatient. Remember that these patients are considered infective for the first 2 weeks after they start treatment. You want to advise these patients to avoid going to malls, taking mass transportation, sleeping with their significant other. You want to have them limit visitors. You also want maybe to have them to keep windows open in the home so air is moving in and out pretty quickly. Remember, treatment involves medications, and it involves medications over a long period of time. So these patients we have to report these cases to the public health department. They're going to monitor them for adherence to treatment, and we need to educate about this. This is very important that they take the treatment seriously. Usual course of treatment. Usually, initially a 4-drug regime, INH, rifampin, PZA, and mimebutol, given daily for about 8 weeks. Then they go into this continuation phase, where they'll continue 2 drugs, usually, for 4 to 7 months on a daily basis. Education is crucial. We want to make sure that they understand the importance of taking these on a daily basis. Now, if it's a population that's at risk, a person that's at risk to maybe not adhere to the routine, they may require direct observation therapy because they have to make sure these patients get the medication, because this is going to prevent this whole thing from occurring, right? It's going to prevent this contagious disease being spread out into the community. So nursing management, what's the health promotion goal? Wipe it off the face of the earth. We don't want this disease on it. We also want to develop screening programs for high-risk populations. Acute intervention. So say they're admitted to the hospital. They're going to be put on airborne precautions. We're going to use HEPA mask filters when we're taking care of them. We're going to do chest x-ray, sputum collection, and initiate drug therapy. We're going to teach the patient pulmonary hygiene. For example, covering their mouth when they're coughing and sneezing, disposing of their sputum-soaked tissues in a paper bag so that they're not out in the open, like not just laying on the bedside table or on the floor or in the bedding. And we're going to treat that drainage like infectious drainage. When we transport the patient, we're going to place a mask on their face. It's just a simple surgical mask. We also want to make sure that, CT, if they say they're going down to CAT scan, we want to make sure that they know that this patient is in for a rule-out TB or a positive diagnosis of TB. So they recognize this. While in the hospital, you want to limit visitors. You also want to identify and screen close contacts because they need to be tested as well. That's happened in the past here. We've had some TB cases in local high schools, and they've had to test the entire class. Remember, once discharged, they need to have a negative culture to be deemed not infective. Usually these cultures are done once a month. So discharge teaching, the focus is to minimize exposure to close contacts. But like I said, you want to keep a window open at home. They should sleep alone if they're still considered infectious. Spend as much time outside as possible. Limit time in areas where people congregate, so like going to church probably isn't a good idea at this point. Teach the importance of adherence to this drug therapy. Notify public health officials. And that's pretty much all about TB you need to know.